Hello, everyone. Welcome to this month's webinar. My name is Chad Sievers, and I'll be your webinar moderator for today. I'm the project manager for Arkansas Building Effective Services for Trauma, or RBAST, and we are a state-funded program at the UAMS Psychiatric Research Institute, and our aim is to improve mental health services for children who have experienced trauma from events such as abuse, natural disasters, or even family separation. We work really closely with our state's Child Advocacy Centers, and we're just really excited to have our webinar this month be on that topic. And we're probably best known for providing training opportunities to mental health professionals. So just want to give a warm virtual welcome to everyone. I'm going to do a little bit of housekeeping, and then I'll turn our webinar over to our speaker today. So just a couple of things. We encourage questions. Please type those in during the presentation. The question feature is found on the right side of the screen. If you're interested in earning a CEU, please stick around to the very end. There will be a code that's shown on the screen. And after the webinar, I will send out a survey that you'll be asked to enter that code in. And I'll give some more instructions at that point too. We are recording this webinar, and we'll upload this presentation to our YouTube channel. And if this topic interests you or other training opportunities, probably the best place to see or hear what's going on is on our Facebook page. We also have a monthly newsletter where you can get updates that way too. So I'm going to turn the webinar over to Krista Neal. And aside from being a very talented and gifted therapist, Krista is also the executive director for one of our state's child advocacy centers, the Percy and Donna Malone Child Safety Center, which is located in Arkadelphia. So it's just, I've had a history of working with Krista, and she's just wonderful to work with, and I'll turn things over to her.
Thank you, Chad. I appreciate it. I'm going to make sure I have my little arrows that I can move the slides. I'm not seeing them come up. I apologize to everyone listening. I'm not as technologically advanced as Chad. Okay, I think, yes, so they're working now. Alrighty, so thank you for the intro, Chad. I appreciate it, and I appreciate all that you do. Like he said, my name is Krista Neal. I am the director of the CAC in Arkadelphia. I'm a mental health therapist as well. I also sit on the board for the state chapter of the Children's Advocacy Centers of Arkansas. And so when Chad asked if I would do a webinar talking about CACs, I thought that it would just be a good idea to just do an overview. I think I'm not really sure who my audience is, which is not a good thing for public speaking, and I know that, but we'll just act like I know who you are. But I think it would be helpful for most people in this field to understand the Children's Advocacy Center model, why it was developed, where it came from, and really what we do. So I'm going to start with a very broad lens and talk about all the history, why we do what we do, and then we'll talk a little more specifically about the services. And if at any time there's any questions, you know, please just I can stop and answer those. So I want this to be as interactive as it can be through webinar. So the mission of the Children's Advocacy Centers of Arkansas is protecting Arkansas's children by investing in child advocacy centers in our state. So all services provided at the centers across our state are provided at no cost to kids and families. The Children's Advocacy Centers of Arkansas is actually an umbrella organization that supports the individual centers. So each center is an independent, most are independent nonprofits. There's a couple that are under the umbrella of a hospital, but we're all independent, and then we are part of the membership organization of the CACs of Arkansas, which helps support us. So what is a child advocacy center? You know, I think I've tried to narrow down an elevator speech on this topic. It's very hard to, but as you can see here, it says we are child focused. We are a place where investigations are coordinated, and the goal is to help provide the best services, most thorough investigation for alleged victim children and their families so they can experience healing. So what is the problem? The reason CACs are needed, as I'm sure since most of you I believe are related to the mental health field in some way, the problem is that kids are abused and experience trauma. And in Arkansas last year, there were over 30,000 child abuse, child maltreatment investigations that took place. And so what that means is there's a lot of kids going through the quote system during a child maltreatment, child abuse investigation. So, forgive me, I've been sick for a little bit. So this little graphic here is kind of silly, kind of cute. We usually tend to be a little childish in our presentations, but right here shows you what investigations and child maltreatment processes used to look like prior to the Children's Advocacy Center model. So it's been, gosh, I guess it's been close to 30 years ago now, in Alabama, and I like to joke and say that I didn't know anything good came out of Alabama, but in Alabama, the CAC model was developed. There was a prosecutor in Alabama that realized that the investigation and all of the players and all of the siloed pieces in that investigation was actually as traumatic sometimes to kids as their abuse. And so the idea was that there should be a coordinated joint effort for child abuse investigations, so it wasn't just being done by different agencies and different people by themselves. So, you know, truly the situation was at times that there would probably be two different investigators doing their own investigation, not coordinating with each other, which meant that they questioned the children multiple times. Kids were often interviewed maybe in a police station or maybe in a hospital. And I don't know about you guys, but I mean, I've worked in this field for quite a while now, and I work with law enforcement all the time. And still, even if someone told me, meet you at the police station so a guy with a gun in his holster can question you, I would be intimidated and think that I did something wrong. So really what was happening was not what was in the best interest of the children, and it was not helping the children heal from what had happened to them. So moving on to the next slide, and again, stop me if at any time you have any questions. So the whole idea though with the Child Advocacy Center model is that there is a single location where a variety of services are offered to a child and their non-offending caregivers. The CAC staff is in no way the only professionals that serve kids on site at our centers. We coordinate with local law enforcement, we coordinate with DHS here in Arkansas, we coordinate with the prosecutor's office, we coordinate with who else across the community that is involved in these cases, and we make sure that from the first step of the investigation that there is a coordinated approach that is focused on helping the child and family. And so that means that a child is not questioned numerous times by people that aren't trained to interview children. You know, it's interesting because I think there's a lot of very well-intended investigators now, and especially then before the model was too prominent, a lot of really great investigators, law enforcement investigators that probably did a great job finding perpetrators and offenders and interrogating them and finding out the details of what happened. But those people were not and still aren't trained to work with kids and to question a child in a way that elicits their true story. And so so we are really proud that we actually do provide those services on site. And the way I kind of look at it is we get to cover the piece that we're good at and that we're trained in, and we let everybody else kind of fill their role as well, because they're really good at other pieces of the pie. And then if we're all working together doing our specific strength, we need to know our strengths, right? If we're all working together in utilizing our specific strengths, then the most effective approach is happening. So, as I've kind of referenced, these are a variety of our services that we provide. These pictures right here from 3 different centers. The top left one is actually my center. That mural was done by some high school art students when we were first trying to get up and going and had no funding for anything, and they graciously painted for us, and it was wonderful. The bottom left is actually the waiting area in the Springdale Center, and I'm unsure, I cannot remember for sure where the other picture came from, but this is the type of environment that we provide for kids and families when they come to the center. So we provide, as it says, forensic interviews, child and family advocacy, community education and awareness, mental health services, and medical services. So as I said earlier, and I kind of went into this a little bit, is we don't fight alone. I didn't reference how the piece is coordinated, but at least monthly, all of our counties, we meet with our what's called multidisciplinary team to staff and review the open child abuse investigations. So what that means is we are regularly, every 30 days at least, are staffing and making sure that no cases are being pushed to the side or falling through the cracks. We get together literally face to face with all of the folks on this slide right here that are involved in our child abuse investigations, and we just make sure that all the T's are crossed and all the I's are dotted. And those MDTs, those multidisciplinary teams, are very important across the state to ensure the best services for the kids that we serve. Okay, so what's so great about CACs? I'll go ahead and show you my cards and tell you that I'm extremely biased. Extremely biased. I can't decide if I should tell stories when I do these webinars, but I'm going to. When I first got this center up and going, I obviously wouldn't have been, trying to start a CAC if I didn't know there was a need. I was familiar with the model somewhat. I obviously have been doing mental health therapy, so I knew that kids were traumatized, kids went through terrible things. I knew there was a need. I didn't know, though, I had no idea how large of a need and how life-altering it would be. What's so great about CACs to me is I could go on for probably hours, literally, but I want to give a specific example of what was very impactful to me when I first started. So we'd only been open for a few months here at the center, so a very small staff at the time. I believe it was just, it was me, it was our forensic interviewer, and then we had an intern that was helping with advocacy. And we had a family here. We had a mom that had come with her teenage daughter, and then we had some supportive friends of the family that were in the waiting area. So the mom and supportive friends, and then we had the young lady that was in the back getting her forensic interview done. So she was talking to our forensic interviewer. And so I was still kind of serving in the advocacy role at that time. So I came in to check on the family and supportive friends in the waiting area. And when I came out, I said, I just want to check on you guys, see how you're doing. I know this is difficult. And the supportive friend said to me, the lady, it was a male and a female, the lady said to me, yes, it is really hard. The man that hurt her is my father. And I said, oh, I'm so sorry. And I know that makes it even more complicated because it's your father that's the alleged offender. And she said, well, he actually raped me and my sisters as well during our childhood. I was still new to this field. That to me was a lot to take in that moment. I learned soon after, as I sat down and tried to process with her, that what actually had happened is this young lady had told someone when she was a teen. She told someone, but then when she and her sisters were interviewed, they were interviewed and questioned about the allegations at home with their father in the next room. They were interviewed and questioned about these allegations at school with their father across the office, in a different office, but across the office, and they denied it. So when there was this accidental disclosure or this tentative disclosure that one child did give, when they were actually asked about it in an unhelpful way, they denied it. And so then fast forward 10 years, and she's sitting in the waiting area while a family friend is telling about him raping her as well. Before that situation, I believed in the CAC model, but that was a moment that was a turning point for me, and I realized just how very important it is that kids are given the best shot to tell their story. and how the alleged offender does not need to be around during this interview or the questioning of the child. So what's so great about CACs? Higher conviction rates. We help prevent abuse and keep children safe. When we are providing this safe place for a kid to tell their story, that means there's a greater chance of charges actually being filed against an abuser. There's a greater chance that that person will have access to children. We also go and we educate the community, and to me that prevents abuse. That's empowering people. I'll talk a little more about that later. We serve a bunch of kids. I mean, and we're honestly serving more than ever. This year we've actually almost doubled the number of victim children that we've served. We help kids be able to testify in court if it gets to that point. And then we're committed to providing evidence-based interventions. So we're not trying to just go and do some willy-nilly thing, but we really want to provide what we see from research as the most helpful way to intervene with kids that have experienced trauma. So I don't know if there's any questions so far. Chad, has anyone had a question yet, or any feedback?
Yeah, and I don't know if you're going to get to this later, Krista, but could you talk a little bit more about how you help children testify in court?
Yeah, so that I don't believe that is a slide later. So, well, I know in our area, especially when we started, I think that law enforcement and prosecution were often like really terrified to have children testify. And although I don't enjoy that a child has to go through that, I really don't. And I really sometimes get frustrated that so much of a burden is placed on a child during a court proceeding. But what we've experienced is that when a child is given the resources and experiences healing through the mental health therapy, that on the other end of that, that they actually are can be, although it is very difficult, they can be extremely empowered by going to court, sitting on the stand and telling the story of what happened to them. This power shift is amazing. So we, I've watched so many kids that have once been in complete control of their abuser. But then when the table turns and the power shift is different and that child feels empowered and realizes that that person does not control them, then that's really a beautiful, I believe, a beautiful piece of healing that a child gets to experience. And I'm not trying to say that every time it's beautiful. It's often ugly and beautiful at the same time. But what we do, so we have an awesome little miniature courthouse model. Like, it's very much like gradual desensitization. I mean, we, introduce the idea of this might end up going to trial. We have this little courthouse model that's awesome that we can set up and shift like the jury box and things like that to make it look like whatever courthouse we're going to be in. We are able to just like kind of walk the kids through using these little like wooden dolls to tell them what's going to happen, where they're going to be, where so-and-so is going to be. But we also go with them and help them just feel comfortable there at the courthouse. I mean, courthouses, jails, all these places, police stations are scary, but I think that, by kind of gradually exposing them to that idea, then I think that it helps them feel empowered. And so that's a lot of what we do. We obviously never want to tell the child what to say. We always, if we're there and the prosecutors may be questioning the child in an attempt to have them prepared to testify at court, we never tell them, okay, be sure to say this. We just always tell them, just tell your true story. Whatever anyone asks you on the stand, you tell them the truth. And so that's a little bit of what we do. Does that clarify a little bit, Chad?
Yes, thank you.
Yeah, no problem. Anyone else? Any other questions?
I'm not seeing any more at the moment.
Okay. I can't find my little arrow. Okay, there we go. Alrighty, so like I referenced earlier, we do forensic interviews. And so in Arkansas, for the most part, all the CACs follow what's called Child First Forensic Interviewing Protocol. And what that means is all of the individuals that provide forensic interviews on site at our centers are certified in this protocol. So it's a national protocol that's legally defendable. It's non-leading. It has a very set way of proceeding through the interview. It's child-led. It's a great protocol that we use. And so during these interviews, it's just the alleged victim child and the forensic interviewer in the room. There is also at least one investigator that is observing the interview live. And then that is a coordinated effort to make sure that all information is gathered, all needed information is gathered in that single forensic interview. So like I said earlier, before the CAC model, it might have been that the kids were questioned at school, then questioned at the police station, then questioned at the hospital, blah, blah, blah. So, but this means that there's only one official forensic interview. We provide digital recordings of the interview to the investigators and or prosecutor, depending on who needs it. And so it minimizes the trauma for the child. And honestly, it minimizes muddying the waters. I think if anyone that has been around kids very much knows that if you're talking, especially a child maybe ranging in age from like 3 to 7 or so, if you're talking to a 3 to 7-year-old and you're asking them the same question in like 4 different ways, you're very likely to get some sort of a varied response, just because of the nature of them being asked a same question differently. If you have 3 people asking a 5-year-old the same question in 3 different ways, you might get different pieces of an answer. And so naturally, questioning a child over and over again muddied the waters when it came to investigations. And so that's another thing that this does. It's less trauma for the child, but it's also honestly less trauma to the investigation. So, all right, next slide. Child and family advocacy. So it's not a joke, but we kind of joke around here that literally there's never anyone that's excited to walk through our front door. Every time a child and family comes here, it's in the middle of a crisis. At best, it's a misunderstanding and there's been an allegation of abuse, and the child comes and says, no, that didn't happen, someone misunderstood or misinterpreted something. Yeah, so that's at best though. It's still not an enjoyable situation when they show up here. So our child and family advocate, that piece is a huge piece of what we do. So families are always in the middle of a storm, and so I know that in my life, when I'm in a storm, I forget my resources and I forget I lose my bearings and I forget all of these things, my coping skills or whatever. And so the family advocate helps introduce the kid and family to the process. Prior to the CAC model, if there wasn't someone there alongside the child and family, it's very easy to get lost in the legal and investigative process. There's so many things that go on that just the general population is not knowledgeable about. So the child and family advocacy piece helps connect the family with whatever services they may need too. We may have a family that comes here and they're doing fine and the child is not experiencing, severe traumatic symptoms and all is well. And that's great. And we want to continue to support them as long as they want us to. But we may have kids, and we have had kids come that need food. They don't have a house to go home to. They don't have clothes. They need legal help, whatever it may be. The child and family advocacy piece meets the family where they are and helps support them as long as they want us to. So we don't ever just like dismiss folks. We continue to help them as long as they want us to. So let's see. Our mental health services. So there are mental health providers that are connected with all the CACs across the state. The majority of CACs have mental health providers that are actually on site at the center. Some of them, though, have contract providers in the community and such, but the vast majority, close to all, have mental health providers on site. So we provide crisis intervention, the trauma-informed treatment. We provide evidence-based models, and I'm going to talk about a few of those later. And if kids are involved in a child maltreatment investigation, if they are referred on the front end to a CAC, then they are twice as likely to receive mental health services than they are if the investigation is handled independently by an investigative agency. So when kids go through the CAC, they're much more likely to get the type of mental health services that they need and could benefit from. So I'm just going to go through a handful of the models that are provided on site at CACs. Recently, there's been a couple of more that are provided, but these are, I would say, the main ones. Trauma-focused cognitive behavioral therapy. I'm sure most of you, I think most of you are probably familiar with this. This is a model that I believe is made available through all CACs in Arkansas. It is it's a flexible model, evidence-based model that's for kids and teens. It is based on practice skills and involves caregivers. It is a brief evidence-based model, and it's very powerful. You know, I think one of the most powerful pieces of the trauma-focused model is let me think of the right word here, like the regaining ownership of a child's life or their story. And I think that one piece of this model is a trauma narration, where there's the unhelpful worldview and beliefs about themselves and or their family or others is kind of broken down piece by piece with the therapist. Regaining ownership of a child's story is amazing. When I complete this model, and when a child and family realizes that there was a chapter of their story that was written and that was by someone else, and that was maybe a really ugly and devastating chapter, but that story and chapter in their story does not define them, and that's not where their story ends, that is so powerful and so beautiful. And I think this model actually does a really good job of enabling that for kids. So again, a great model for kids and teens. A little more recently, Our Best has been able to provide significant training in also parent-child interaction therapy. That's something I'm also trained in this. It's a structured model that is evidence-based for kids ages 2 to 7. Originally, it was developed for kids with behavior problems. It is solely a working with the child-parent dyad. So it strengthens the child and parent or caregiver relationship. It is very powerful. There's research that also shows that it benefits kiddos that have experienced trauma. I think a big piece of that is because of the heavy focus on the child-parent relationship in the first half of the model. This is a very, very, very structured model. I've seen it be very powerful and life-altering to kids and families. It takes a lot of effort by the parent, but honestly, I mean, in my opinion, I think a lot of times mental health providers let the parents off too easy, if that makes any sense, and don't demand their involvement. And really, if you're working with this age of child, and if you're working with traumatized kids and the parents aren't involved significantly, then obviously I think that the best outcomes are not going to happen. So this is a great model. I really, really like it. There's live coaching involved. It's really structured. I love it a lot. Excuse me. So child-parent psychotherapy is one that I'm not trained in, but I know that there are several centers across the state that do provide this. So if there's someone that is trained in this and they want to add more, please do. It is also a structured model that involves the child and parent. It was, I believe, developed to work with kiddos that have experienced trauma. It's effective for kids at 0 to 5 as well, and I've heard great things about it, absolutely great things. Chad, do you have anything extra to add about the CPP or in comparison to PCIT possibly?
No, I think you did a great job, Krista. I mean, for PCIT, you're absolutely right. It's much more structured than CPP would. But one of the reasons for us wanting to roll out this intervention that's on your screen is to reach those little bitty kids. So because we know that they are the most vulnerable group that we work with. So
yeah, absolutely. Okay, great. Okay, so any questions, any other questions come up yet? I can't tell if people have questions or are engaged or disengaged. So.
One other question that came in, Krista, is could you speak a little bit about what an advocate's educational background is? Are they typical social workers, a psychology background? Can you talk a little bit about that?
Yeah, so I mean, really, the advocacy role It kind of just depends on center by center. There's specific training that we provide in that role, but a lot of times we like to have someone that has a degree or comparable experience in maybe social work or psychology, social services, or even, honestly, in my experience, it's been really great to have people that maybe were like in early childhood education or something like that have experience with kids and families and handling that. And honestly, what I have decided is one of the most important characteristics of the child advocate is just to have a disarming personality. You know, like I said, when families come in, they are on edge. They can be on edge because they're angry their child was abused. They can be on edge because they're angry someone knows about it. Whatever it is, they are on edge, heightened. And when someone is able to disarm them quickly, then the healing and relationships can begin. And so often, you know, we want some experience with kids and families or experience in dealing with crisis situations. And then there's a ton of on-the-job type training as well.
Okay, thanks.
Yeah, awesome. Good question. And I could talk about this for forever, so I'm trying not to go too long. I don't want to miss anything, but I'm trying to go too long too. So medical exams. So we provide on-site, we provide sexual assault exams to kiddos that during child abuse investigations. So basically, it's we provide a full body head-to-toe assessment by our sexual assault nurse examiner. We can provide rape kit administration, DNA collection if it's there. Honestly, most of the time kids wait a while to tell about abuse, so DNA collection is not an option very often. So that's also another piece that makes it difficult to prosecute these cases, is because our juries now expect CSI and all those things, and that's rarely how child abuse investigations pan out. So we provide these sexual assault exams on site at our centers. I don't know where all you guys are from, but we live in Arkadelphia, and sadly, and even in more populated areas, but sadly, a lot of the local rural hospitals have no one that's trained to do these exams. No one, even like local pediatricians, not trained to do these exams. Emergency rooms in our area have turned away kids. So parents won't know what to do. They'll have their child tell them that they've been raped. The parents will rush them to the hospital, and then the hospital is like, I can't do anything. And so we're very grateful to have sexual assault nurses that provide these, and these nurses are also, during their trainings, are also trained to proceed in a way that is reassuring and helpful to the child and the family. And so it's really a great thing that they have these on site at our centers. Alrighty. Well, here's my little arrow. All right, so education and prevention. This is a huge piece of what we do. So I remember when we first got started here at the center, I remember child after child coming and telling us their terrible story of years of sexual abuse, and then telling us that they did not even know that what was happening to them was abuse until they maybe heard someone talking on the playground, or they watched a CSI episode or something that was devastating to me, that's how a child learned that what was happening to them wasn't okay. And at that moment, I remember being determined to establish awareness and education in our schools. And this is a more recent, I guess, effort that we've been taking across the state. So there are pockets that are very strong in this across the state. This is not available in all areas yet, but I'm proud to say that every school district in our service area, we provide body safety lessons to kids in pre-K through 6th grade, and it's really life-changing. We've seen kids that report right after our lesson because they're told to tell. We tell kids to think of 5 trusted adults that they use the Empower Me curriculum. We have them think of 5 trusted adults that they know care about them and would listen if they were to tell them about something. We talk about how it's never okay for anyone to do certain things to your body. We talk about body parts that belong to you. Anyway, it's very empowering. It's wonderful. We last year, last year in the spring, I remember going into one of our local elementary schools, and we were doing a review lesson, and we had kindergartners chanting the 4 body safety rules because they knew them. This year, I went into a classroom of 4th graders, and before I even said them, it wasn't even a reminder, it was the first time we'd been that year, and they were telling them to me. They had them memorized prior to me even saying them. So it's really awesome to see kids empowered. Along with that, we do mandated reporter trainings for teachers. We try to make sure that if the kids are going to tell someone, that we're also empowering those adults to keep them safe. We talk to anyone that will listen. We talk to community groups, churches, whoever it may be. We talk about internet safety. We do everything that we can to help empower kids and families. So, any questions about that?
None right now, Krista.
Let me see if I can get. Sorry, well, your arrow's being funny. Could you move me on to the next one, Chad, if I can't? There we go. All right, so like I said earlier, we're all private nonprofits, all the centers across the state. We all go through accreditation from the National Children's Alliance. So we have 10 standards that we are striving to meet, but we provide those standards in a way that meet our service area. So, excuse me, in Arkadelphia, my community and the other counties that we serve may have different types of needs than a more populated area or more urban area. And so we just make sure that we meet the needs of the kids and families in our service area. We often have on staff a director, interviewer, advocate, medical provider. Sometimes we have development people to help with fundraising because we are a private nonprofit, so we solely depend on grants and private donations. And oh my goodness, I won't even bore you guys with that, but that's an adventure. But anyway, we do a lot of great things with limited resources and with a lot of passion. So there's just some more pictures. Some of the centers are in older homes, older houses. We're actually in a renovated church building, so they all look a little different. The top left there is my front door, and we all are growing. So this is a service area map of all the centers in our state, I believe, and I don't want to misspeak, I believe there are 17 centers, and then with about 5 or 6 satellite centers, which is just a smaller location that services are provided. It was just a few years ago that this map looked very different. We've seen a significant increase in CACs across the state, which is wonderful. Okay, so what can you do? Support our work, visit your local center, help advocate for us. There are days that I really wish I didn't know what I do know about child abuse and child maltreatment, all these things, but I do know those, and so that propels me to do the work and to help advocate for changes in lots of different areas of this world. But what I love is when I get to talk to people about it, I'm also handing off the burden to you. And so I hope that what I've told you today can propel you, and whether it be in your mental health practice or in your personal life, empowering your own kids, or just sharing about this in your community, or maybe trying to seek out and get a tour or find out more information about your local CAC. But I hope that today that you were informed and motivated to do something a little different. So, any questions though before I guess I completely wrap up?
Thanks, Krista. So we have a little bit of time. Do you want to type in some questions? And a couple of come in. And so one person asked, do you see many false reports at a Child Advocacy Center?
So that's kind of a complicated question because, for instance, we've seen times that maybe a well-intended mandated reporter misunderstood something or misheard something, and so then made a report, and then when the child came here, then they, when they were interviewed, they told what happened and it wasn't maybe what was reported. There have been times that that there were reports that were false. Often often, though, the majority of the time, no. The majority of the time, I think it's more likely for a child to actually deny when they have been abused. You know, one study I know says that, you know, kids, I can't, I'm sorry, I don't have my stats in front of me, but I think that kids often wait not to tell if they even do tell. And I think that the biggest predictor of there being actual abuse is that a child did tell. Now, I'm not trying to say that that there's never a false report, but very often the truth, because what we try to do is seek the truth. And so very often if there has been some sort of inconsistency or misinformation prior to coming here, we attempt to, during the interview, find out the truth of what actually did or didn't happen.
Thanks. And we'll advance to the CE slide here shortly, but another question that came in, Christy, you mentioned the body safety training that you do in schools. Is that for a particular age group, or can that be tailored? Can you just talk about that a little bit more?
So the Empower Me curriculum that we mostly use is for pre-K through 6th grade. We do provide other type of body safety, internet safety type trainings for the older kids. And obviously in implementing, we change what we say and how we say with the little ones as opposed to the older ones. And so, yeah, we try to, you know, with the older kids, a lot of times it turns into more of a, what I think, internet safety and like consent type discussions, because that's where things get a little hairy sometimes with the teenagers, is consent or lack of consent. And then anyway, it's a very difficult thing when teens are not maybe not raised or taught healthy respect of themselves or others, and that can complicate in some situations regarding consent. And so we like to try to empower all ages to understand that their body belongs to them and that no one else should decide what happens to their body.
Another question that came in is, do all of the kids receive a medical exam when you come to the CAC?
No. So there is what we call the 6 Ps that is provided to us actually through Children's Hospital, Dr. Karen Farce there. That is kind of the standard of when a medical exam should be made available. And it's just based on if the child is alleging contact, you know, a variety of things, that they've been exposed to a perpetrator. I mean, there's just a lot of things that helps the team make the decision on whether a sexual assault exam should take place. But there is also a difference between like a sexual assault exam with a rape kit, and then also just a assessment. We do STD testing, pregnancy testing, all those sort of things as well. So.
Another question that came in is somebody wanted to know how many CACs are set up for PCIT and child parent psychotherapy, or CPT. I might be able to speak a little bit about that. I want to say maybe 2 or 3 centers are actively doing PCIT in their facilities, and probably around 10 or so, I would say, centers are doing child parent psychotherapy. Don't quote me on that exactly, but just from memory, that's what I'm thinking of. So for a lot of reasons, PCIT is sometimes harder to get up and running in a center, whereas CPP is more of a natural fit. I don't know if that makes sense, but that's sort of what we've seen on our end, is that CPP is kind of more of an easier intervention to get up and going within a CAC versus PCIT. So, because a lot of times for the PCIT, there's an observation room, and sometimes that's taken, or you have to kind of figure out if there's an interview going on at the same time, like how do you work around that? So there's just some other kind of complications like that. Chris, I don't know if you want to add anything to that.
Yeah, absolutely. Yeah, absolutely. I think that it's a complicated model to implement. I think it's extremely powerful and effective, but it's definitely not easy to implement, especially on the front end.
And we'll do one more question here, then we'll advance to the CE slide. is somebody had asked, what's the education background for a forensic interviewer? What are their qualifications, or who can do those?
Yeah, so generally speaking, we want someone that does have some experience in a related field, but there's not like a necessary degree background. We do that training as well on the job, if you will. So, when we've hired forensic interviewers in the past, they haven't been able to actually do a forensic interview until they've gone through the protocol certification and then had time to observe and learn the model and how to proceed as an interviewer. So there's not a set, kind of like with a mental health therapist, you have to have qualifications for state licensure and all that, but it's not like that for the victim advocate or for the forensic interviewer. The training is certification through the job generally.
Okay. All right. I'm going to advance to the CE slide.
One thing, Chad, I did forget, you mentioned this to me earlier, was the referral process for the CACs. I forgot to mention that. So
yeah.
And sometimes I think people get confused. So like, we do get phone calls and such from concerned family members, but we cannot just quote take someone off the street, if you will, to do an interview. If we get a phone call or a concern from a family member, we help them navigate and make the report as it should be through the child abuse hotline. So all referrals of child abuse in the state of Arkansas have to go through the child abuse hotline. So that means even, I did a training a couple of months ago for all the local law enforcement around this area, and I reminded all of them, you are all mandated reporters. If you suspect child abuse, you too, even though you're a law enforcement official, you too have to report to the child abuse hotline. So all of these, or all child abuse investigations, are funneled through the hotline. So once the hotline is notified, the operator decides whether or not it meets criteria for an investigation. And if there is an investigation that's initiated, it's sent to either the Crimes Against Children Division of the State Police or the Division of Children and Family Services of DHS. And then local law enforcement is coordinated, and then that's who reaches out to us. Either CACD, DCFS, or local law enforcement helps initiate that forensic interview on the front end.
Thanks for that clarification. I think that's very helpful for a lot of people.
Yeah.
So the code today is 1012. So after we end the webinar, I will send an email to everyone who attended. If you're watching with a group at your site there, you can just forward that email on to others who watched in there. So it'll be kind of like a Google survey that gets sent, and when you enter that code, a CEU will be sent to you based on this code. So write it down, commit it to memory, 1012. And I guess maybe a final question for you, Krista, is if someone really wanted to get involved with the CAC, what's kind of the first step? What's words of advice for the crowd on that?
Well, I would say to identify your local CAC and then reach out to them. I really will talk to anyone that will listen about this, and most directors and people that work at centers will. You can have tours of the center. You might be able to volunteer, or if there's a job opportunity, or just, we just recently formed what we're calling an advisory council, and that we're just having quarterly meetings to help inform more community members about everything we have going on. There's just a lot of moving pieces, and we need a lot of support from the community to keep all those balls rolling and to continue getting the funds that we need to function. So I don't know, I think just reach out to your local center, and I would always be, if anyone wants to email or call me, I can help put you in contact with your local center. And then there's always ways to be helpful, I think.
All right. Well, thank you, Krista. I'll leave this slide up here for folks that need it. But thank you, Krista, for presenting today and letting us know what a CAC is.
Yeah, thanks so much. I appreciate the opportunity. Thank you guys for listening.
Okay, everyone have a great day. I'll leave this slide up for a few more minutes.